Good morning and welcome to this workshop on building trust in public health emergency preparedness and response science. Let me introduce myself. I'm Sandra Quinn and I am the chair of the Workshop Planning Committee. Our sponsor for this workshop is CDC's Center for Preparedness and Response. So we have several goals over the next 2 days. And we will consider the roles of trust and trustworthiness in public health emergency and response PEPFAR science, and across the continuum of an emergency, from pre-event to response to mitigation. We will bring together the scientists and researchers who work on PEPFAR science, along with practitioners, media, and the public. And we're going to explore the history of PEPFAR science, how it's communicated, the infrastructure underlying it, and its relationship to social cohesion and solidarity. In designing this workshop, we based our approach on the definition of PEPFAR science. So it's the scientific evidence base that guides and informs the actions of local, state, tribal, territorial, and federal public health agencies, and how they respond effectively in the midst of any public health emergency. And we know just from our lived experience that we are having increasingly common public health emergencies, from wildfires, fires to hurricanes, to droughts and other things, as well as obviously infectious disease pandemics. They're also increasingly complex. Having trust in the science that underlies how we respond to an event is key to an effective response. So we've got 2 full days of what we think are going to be very exciting conversations. We're going to have presentations and panel discussions. So let me sort of give you a sense of where we're headed today. So we're going to start this morning with sessions examining trust in science and trustworthiness and credibility of the spokespeople and the agencies that communicate that science. We're going to explore issues of trust in PEPFAR science across different demographic groups, as well as strategies and interventions that might build and maintain trust with those diverse groups. We'll take a break a little bit later, and we'll come back to our last session, which will be about the infrastructure and the workforce needs that are necessary to build and maintain trust in public health agencies. Tomorrow, we're going to focus on communication, and we're going to start with a conversation on how do we translate and communicate the science of the emergency to the public. We'll have a session that focuses on one of our critical issues of the day, mis- and disinformation, and we're examining questions such as who is susceptible, who's vulnerable to mis- and disinformation, and what strategies can we use to help manage and reduce that vulnerability. The final session is going to focus on the information environment, looking at strategies for managing information overload, that we can communicate and share with the public during emergencies. And we recognize all of this is happening in the context of uncertainty and usually evolving information and changing science during an emergency. And then here's where you come in as critical is we will close out with a participatory workshop in which you will have an opportunity to reflect on what you've heard, think about where we should go in the future, and then we will end with some comments from our CDC colleagues. So it's a full agenda, and we're very excited about it. And we know that this is a much larger topic than we can fully tackle in 2 days. So we see this as we recognize we're not going to cover every issue, But we also see this as a critical start to what will be hopefully an ongoing conversation for the future. We have a great slate of panelists from around the country, and we have diverse audiences too. So we have practitioners from federal, state, local agencies, we have scientists, we have media, and we have members of the public. So it's a very exciting sort of array of panelists and audience members. So you will have opportunities to participate during this as well. And so we will have a live Twitter event hosted at the NASM, where you can follow along, you can participate, you can retweet. And we have a discussion section in Slido that's on the events page, and that's another place where you can submit questions, ideas, respond to prompts. And then our last session tomorrow will really be using a virtual whiteboard to really begin to reflect on where do we go from here. So as we go through today and tomorrow, please keep any thoughts and notes you have, for inclusion on that whiteboard about where do we go from here. When we finish this, the National Academies will produce a summary of the presentations and the discussions. So, keep your eye out for that. It will be coming over the next several months. So the planning committee, the staff are very excited about this. We think this is going to be a dynamic and thought-provoking 2 days. And we are thrilled that you're willing to be here with us to be part of that.